You're considering cataract surgery and you've been told premium lenses can give you freedom from glasses. But here's the blunt truth. That freedom comes with a cost that's more than just financial. These advanced lenses can introduce new visual side effects that surgeons don't always detail. Things like halos, glare, and starburst. In this video, I'm going to try to explain exactly what these visual artifacts are, why they happen, and who should think twice before getting a premium lens. This isn't to scare you though. It's to give you the unvarnished facts so you can make the right choice for your eyes. My name is Dr. John Legarreta, and I'm a board-certified ophthalmologist, and today we're going to be talking about premium lenses. So first I want to define what a premium lens is. And today I'm talking about multifocal, trifocal, extended depth of focus, intraocular lenses. And the primary goal of these lenses is to give you a broad range of vision, clear at distance, as well as for intermediate tasks like computer work, and up close for reading, all to reduce or even eliminate your need for glasses after cataract surgery. This is the promise that is so appealing to patients who want to live a life with less reliance on corrective eyewear. But this isn't magic, it's physics. And to achieve this extended range, these lenses must split light that enters your eye into multiple focal points. Imagine a standard or monofocal lens. It acts like a simple, powerful projector, taking 100% of the incoming light and focusing it onto a single point onto your retina. This gives you incredibly crisp, high contrast vision, but only one set distance, and this is usually far away. For everything else, you need glasses. Premium lenses work differently. They take that same beam of light and typically divide it. So a multifocal lens essentially creates different zones on its surface, sending some light for distance vision, some for near, and some for intermediate. And this division of light energy is what allows you to see at multiple distances. And this brings us to the fundamental trade-off, the optical compromise you must accept. You are trading a certain degree of pristine, high contrast vision for a greater range of focus. The light is split or stretched to create these extra focal points, and it doesn't always land perfectly. Some of it spills over, manifesting as unwanted visual phenomena, which I'll discuss in a little bit. It is absolutely critical to understand this point. These side effects are not complications or defects in the lens. They are an inherent built-in feature of how the lens technology works. Studies have looked at this and they've confirmed that the photopic phenomena is 3.5 times more likely with multifocal IOLs than with standard monofocal IOLs. And while even monofocal implant lenses can cause some glare, premium lenses have artifacts that are a direct consequence of the design that delivers the spectacle independence you want. One way to think about this is like a sound system. A monofocal lens is one perfectly clear speaker. A premium lens is multiple speakers playing at once. You hear everything, but there's a little bit of echo or interference from the other speakers. And understanding this compromise is the most important step in deciding if a premium lens is right for you. So now that I've established that premium lenses come with some optical compromise, the technical term for this are dysphotopsias. And it's a mouthful, but it's a broad term for any unwanted images or light phenomena caused by the implant lens, the IOL. And I'm going to break it down exactly to what you might experience. First, halos. These are glowing rings that you see around light sources like a street lamp or headlights at night. And you might see distinct shimmering circles around that light. This particularly happens because the multifocal lenses have concentric rings etched into their surface to split light for different focal points. And so when light hits the edges of these rings, some of it gets diffracted, creating the halo effect. It's really a direct byproduct of the implant lens design. And next is glare. This is the whiteout effect that reduces your ability to see when looking near a bright light. And the most common example is the disabling feeling from oncoming headlights at night. This is caused by light scattering inside the eye as it passes through the complex optics of your cornea as well as the premium implant lens. So instead of focusing cleanly, some light bounces around, creating a haze that can make it difficult to see what's behind or next to the light light source. And then there are starbursts. These are rays or streaks of light radiating from a bright source. Looking at a distant streetlight, for example, instead of seeing a single point, you might see lines shooting out in a star-like pattern. And like halos, this is another form of light diffraction caused by the IOL's optical design. It's the lens doing its job, but in a way that can be distracting to you. And finally, there's a loss of contrast sensitivity, and this one is very important. The world might seem less crisp, making it harder to distinguish an object from its background in dim light. For example, seeing the edge of a dark step in a dimly lit room might be difficult. And this happens because the lens splits light energy to serve the multiple distances. And since less light is dedicated to any single focal point, the image isn't always as sharp. It's a direct trade-off of clarity for, again, the range of vision. Now, the type and intensity of these issues truly depends on the lens technology. Multifocal lens technology has improved drastically over the last several decades, and multifocal and trifocal lenses like the Panoptics use powerful, distinct rings to give you strong, glasses-free near vision. The trade-off is they tend to produce more defined and noticeable halos. Extended depth of focus, or EDOF lenses like the Vivity, work differently. They don't split light into separate points, but instead stretch it into a single elongated focal point. This provides a continuous range of vision from distance to intermediate, though near vision is weaker. The benefit is a much gentler side effect profile. Instead of sharp rings, patients often describe a mild glow or smudge around lights. This is why EDOF lenses often result in higher patient satisfaction, especially for those who prioritize night driving and are willing to use some reading glasses for very small print. To reiterate, the compromise is still there. It's just manifest a little differently. Now that you understand these side effects, that's one part of this. Now you have to know, understanding these side effects is one thing, but knowing if you're a good candidate for the technology is another. And this brings us to the most critical part of this discussion, matching the right lens to the right person. A premium IOL that is a miracle for one patient can be a nightmare for another. And I really want to discuss the red flags. First, the perfectionist personality. If you're an engineer, an artist, a photographer, or anyone whose profession or personality demands absolute visual precision, you really need to be extremely cautious. It doesn't mean you can't have these lenses, but you have to realize that these lenses have built-in optical compromises. You will see halos. You will experience some glare. If the thought of a slight visual imperfection that you can't fix will bother you endlessly, then a premium lens will likely make you unhappy. A standard monofocal lens, corrected for crisp vision with glasses or even contacts for certain tasks, often provides a higher quality of vision that perfectionists appreciate more. Next are the critical night drivers. This includes professional truck drivers, pilots, or even just someone who has a long, dark commute every night. As I've discussed, halos and glare are most prominent in low light conditions. And for some, this can be a minor annoyance. For others, it can be genuinely disabling, reducing reaction time and confidence on the road. The risk of being bothered by oncoming headlights is significantly higher with multifocal lenses. So, if your livelihood or safety depends on impeccable night vision, the potential for debilitating glare really is a serious factor that you need to weigh. And an EDOF lens may be a better compromise, but a standard monofocal lens remains the safest choice for minimizing night visual disturbances. Your own anatomy also plays a role, and this includes your pupil size as well as your retina. In dim light, your pupil naturally widens to let in more light. If you have naturally large pupils, a greater proportion of the multifocal lens with all its concentric rings gets exposed. This can dramatically increase the intensity of halos and starbursts. Your surgeon can measure your pupil size in dim light to help you determine if you might be at a higher risk for these night visual symptoms. And another major red flag is having unrealistic expectations. If you walk into surgery expecting to have a flawless, perfect vision of a 20-year-old, which I would love to give to all my patients, you are setting yourself up for disappointment. The goal of premium lens cataract surgery is as much spectacle independence as possible. And this is the ability to function for most of your daily activities without glasses. It is not the goal to provide supernatural, bionic vision free of any artifacts. And you must be mentally prepared to accept the visual compromises glasses in exchange for that freedom or reduction in need of glasses. Finally, and this is crucial, we have to consider your overall eye health. If you have other significant eye diseases, a premium lens is often not the right choice. Conditions like significant dry eye can make the vision with a multifocal lens fluctuate and appear blurry. If you have macular issues in your retina, like macular degeneration, your contrast sensitivity is already compromised. A premium lens, which also slightly reduces contrast sensitivity, can make your vision feel subjectively worse even if the cataract is gone. The same applies to glaucoma. In these cases, the crisp, high contrast image from a standard monofocal lens is almost always the superior and safer medical choice. So what is the key takeaway today? Premium lenses are a sophisticated compromise. They trade some degree of pristine, high contrast vision for a wider range of focus without glasses. The side effects I've covered are not complications. They are built-in features of the technology. So your decision should come down to an honest assessment of your personality, your lifestyle, your visual priorities, and your ocular health. And before you choose, have a frank conversation with your cataract surgeon. Discuss your night driving habits, your tolerance for visual imperfections, and your desire for near vision. Ask your surgeon which technology they believe best fits your specific needs and why. A well-informed choice is the best way to ensure you are happy with your vision long after surgery. If this video helped clarify the reality of premium lenses, please give it a thumbs up and subscribe for more direct eye facts about your eye health. Also, leave a comment below about any thoughts, comments, concerns regarding this topic. See you in the next video.